It is in accordance with this constitutional duty that I report to this House today. Mr. Speaker, honorable members, let me now turn to healthcare, the foundation of human dignity and the heartbeat of every nation that chooses compassion over neglect. Over the last 3 years, we have undertaken the most ambitious transformation of health systems since independence. Reforms rooted in equity, powered by innovation, and guided by a simple conviction that every Kenyan, wherever they live and whatever their means, deserves equal care. 27 million Kenyans are now registered in SHA, more than triple the number ever reached by the former NHIF. This is a demonstration that leaving no one behind was and is not a slogan. It is a promise on course to fulfillment. Additionally, more than 10,000 health facilities across the country have signed in to serve under this new system. But honorable members, real health care begins long before patients reach a hospital. That is why in September 2023, we deployed 107,000 community health promoters, the largest primary health workforce in our history, trained, equipped, and present in every ward in all our 47 counties. Their impact has been extraordinary. Consider 3 statistics. 8.9 million households have so far been visited. 9.9 million diabetes screenings have been done with 134,000 cases diagnosed. 6.5 million hypertension screenings have been conducted with 305,000 cases confirmed. Millions of lives have been touched and thousands saved. This is what equity looks like. This is the meaning of universal health care. This is leaving no Kenyan behind indeed. Behind these numbers stand the community health promoters, quiet, devoted, tireless, heroes of this new era. Today we honor them. We thank them. To them we say Kenya is healthier because of you. Mr. Speaker, when I promised that those unable to pay would be supported by government under UHC, the cynics scoffed as usual. Today, we are paying premiums for 2.3 million vulnerable Kenyans, including orphans, widows, the elderly, and those without income, because for them, healthcare is not a privilege. And I must commend members of this august House who have stepped in to support vulnerable families in this gesture. We are also modernizing hospital equipment through the National Equipment Service Project, replacing the old MES model that burdened counties with heavy upfront costs. Under the new fee-for-service system, private partners install, maintain, and run state-of-the-art equipment, and public facilities pay only when they use them. We have overhauled KEMSA to end the chronic crisis of drug shortages, raising medicine availability from 48% to 68%, and to a projected 90% by the end of this year and 100% by March next year. This is more than healthcare reform. It is a long-deferred promise finally taking shape. A Kenya where every citizen can face tomorrow with confidence, knowing their nation will stand with them in their hour of need. It fulfills our national values and of dignity and equity as stated in Article 10 of the Constitution. In the same spirit, the government is strengthening financial protection for Kenyans under cancer treatment. Social Health Authority will enhance the cancer benefits package from the current 550,000 shillings to Kenya shillings 800,000, effective December 1. This enhancement responds to the rising cost of sustained cancer care and ensures that patients can access quality, uninterrupted treatment without facing financial hardship. Mr. Speaker, honorable members, when I assumed